Herbs for conjunctivitis of children. Conjunctivitis, also known as pink eye, is an inflammation of the conjunctiva. The conjunctiva is the thin clear tissue that lies over the white part of the eye and lines the inside of the eyelid. Children get it a lot. It can be highly contagious, it spreads rapidly in schools and daycares, but it's rarely serious. It's very unlikely to damage your vision, especially if you find it and treat it quickly. When you take care to prevent its spread and do all the things your doctor recommends, pink eye clears up with no long-term problems. People with conjunctivitis may experience the following symptoms: a gritty feeling in one or both eyes, itching or burning sensation in one or both eyes, excessive tearing, discharge from one or both eyes, swollen eyelids, pink discoloration to the whites of one or both eyes, increased sensitivity to light. There are three main types of conjunctivitis: allergic, infectious and chemical. The cause of conjunctivitis varies depending on the type. Allergic conjunctivitis. Allergic conjunctivitis occurs more commonly among people who already have seasonal allergies. They develop it when they come into contact with a substance that triggers an allergic reaction in their eyes. Giant papillary conjunctivitis is a type of allergic conjunctivitis caused by the chronic presence of a foreign body in the eye. People who wear hard or rigid contact lenses, wear soft contact lenses that are not replaced frequently, have an exposed suture on the surface of the eye or have a prosthetic eye are more likely to develop this form of conjunctivitis. Infectious conjunctivitis. Bacterial conjunctivitis is an infection most often caused by staphylococcal or streptococcal bacteria from your own skin or respiratory system. Insects, physical contact with other people, poor hygiene, touching the eye with unclean hands, or using contaminated eye makeup and facial lotions can also cause the infection. Sharing makeup and wearing contact lenses that are not your own nor are improperly cleaned can also cause bacterial conjunctivitis. Viral conjunctivitis is most commonly caused by contagious viruses associated with the common cold. It can develop through exposure to the coughing or sneezing of someone with an upper respiratory tract infection. Viral conjunctivitis can also occur as the virus spreads along the body's own mucous membranes, which connect the lungs, throat, nose, tear ducts and conjunctiva. Since the tears drain into the nasal passageway, forceful nose blowing can cause a virus to move from your respiratory system to your eyes. Ophthalmia neonatorum is a severe form of bacterial conjunctivitis that occurs in newborn babies. This is a serious condition that could lead to permanent eye damage if it is not treated immediately. Ophthalmia neonatorum occurs when an infant is exposed to chlamydia or gonorrhea while passing through the birth canal. For several years, U.S. delivery rooms have applied antibiotic ointment to babies' eyes as a standard prophylactic treatment. Chemical conjunctivitis. Chemical conjunctivitis can be caused by irritants like air pollution, chlorine in swimming pools, and exposure to noxious chemicals. Herbs for conjunctivitis of children. 1. Eyebright. Botanical name, Euphrasia officinalis. Eyebright may have gained its name from its flowers, thought to resemble the human eye. More probably, experience taught that the herb was good for the eyes, hence the name. Although little researched, it contains constituents known to have a tonic effect on mucous membranes, including those of the eyes. Part used, whole herb. Actions: anti-catarrhal, anti-inflammatory, astringent. Best taken as infusion, tincture, tablet, capsule. In Western herbal medicine, Eyebright is a specific remedy for common eye problems such as conjunctivitis, red eye, and blepharitis, infection of the eyelid. Taken internally, it is thought to heal the surface of the eye, relieving inflammation and drying up excessive watering. Well-filtered, cooled Eyebright infusion can also be applied as a lotion to a partially closed eye. Traditionally, the herb has been taken to improve vision. Routinely taken by hay fever sufferers each summer, Eyebright helps to control allergic symptoms such as sneezing, itchy eyes, and copious watery mucus. Similar conditions that affect the ear, nose, and throat are also likely to benefit from its use. Dosage for adult, 3 to 7.5 grams a day, or 50 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: possible eye irritation when used topically. 2. Echinacea. Botanical name: Echinacea angustifolia, Echinacea purpurea, Echinacea pallida. A plant from the plains of North America, Echinacea is thought to powerfully stimulate the body's ability to resist infection and counter toxicity. Taken mainly as a treatment or a preventative for common cold, flu, and viral infections, the herb also helps heal skin disorders such as eczema and acne. 3 Echinacea species are used medicinally. All are threatened in the wild, but Echinacea purpurea is cultivated widely in the US and Europe. Parts used: whole plant. Actions: antibacterial, antiviral, blood cleanser, immune enhancing, wound healer. Best taken as tincture, tablet, capsule. Echinacea, as tincture, tablet, or capsule, is frequently taken to speed recovery from colds, sore throats, and chest infections. The herb is also known to enhance immune resistance in those prone to recurrent colds or herpes outbreaks or where flu-like symptoms linger. Echinacea combines well with the flower or berry of elder, Sambucus nigra, in this context. The diluted tincture makes a mouthwash or gargle, and can be used to wash infected skin rashes and wounds. Bacterial infections, such as sinusitis, tonsillitis, and chronic bronchitis can be self-treated with Echinacea, preferably in combination with remedies such as garlic, Allium sativum, and golden seal, Hydrastis canadensis, but a fever of 39 degrees Celsius or over indicates the need to seek professional advice. Although the evidence is reasonably good, there is still some debate on Echinacea's effectiveness in treating and preventing infection. This may be partly because the dosage used in some clinical trials was too low, or the wrong plant parts or species were studied. The quality and form of Echinacea products are important. Echinacea angustifolia or extracts of the fresh pressed juice of the above ground parts of Echinacea purpurea are thought to have the strongest medicinal activity. Echinacea stimulates nonspecific immunity, increasing the number and activity of white blood cells. This makes it a frontline remedy wherever the immune system is overburdened by chronic infection or toxic residues, such as swollen lymph glands, recurrent boils, chronic dull headache, or sore throat. Used carefully, and this means in conjunction with an herbal practitioner, it helps in cleansing the lymph system, supporting resistance to underlying infections such as fungal problems, and improving overall vitality. Echinacea is not suitable for self-treatment in autoimmune disorders or HIV infection. Knowledge of Echinacea's medicinal value has been passed down from the experience of Native Americans. Used traditionally as a treatment for snakebite, hence its other common name, snakeroot, Echinacea has been used to prevent septic infection in wounds and as a remedy for toothache, sore throat, and rabies. Dosage for adult, 3 to 7.5 grams a day, or 50 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: can cause allergic reactions. If taking prescribed medication, seek advice from an herbal or medical practitioner. 3. Witch hazel. Botanical name: Hamamelis virginiana. produced by distilling the bark and leaves of this North American tree. Witch hazel water is a useful skin cleanser and tonic. A frequent ingredient in cosmetics such as anti-wrinkle creams, the distilled water heals sore, roughened, or inflamed skin. Parts used: bark, leaf. Actions: anti-inflammatory, astringent, styptic, stops bleeding. For sore or inflamed eyes, grit, or an insect in the eye, soak cotton wool or lint in witch hazel water and place on the closed, affected eye. Allow some liquid to enter the eye. For a better effect, add 5 to 10 drops of witch hazel water and a few grains of salt to an eye bath of clean warm water, and bathe the eye thoroughly, repeating as required. Witch hazel is a useful cleanser for cuts and grazes, stopping blood flow at the same time. In seeping skin conditions, witch hazel water will help to dry up the leaking fluid and calm irritation. Mildly antiviral, the water can lessen pain in herpes sores. Witch hazel tones and tightens irritated and over-relaxed tissue. Either witch hazel water or cream makes a first-rate application for varicose veins and hemorrhoids, controlling inflammation and toning distended veins. Thread veins can also benefit. Dosage: topical application on the skin only. Note: preparations made specifically for tropical use should not be taken internally. Cautions: none known. No longer used internally.